Hello everybody. Today I have the honor of welcoming with me Dr. Nikita Shrivastava. Congratulations Nikita.
Thank you so much,
for coming all the way to Delhi. She is a proud Damsonian and she has secured rank 5 in urology entrance, MCH Urology entrance Aiims 2019 July session. She also secured rank 6 in MCH Urology PGI 2019 session. So congratulations Nikita. How are you feeling now first of all?
Sir, it's a dream come true, and I'm also privileged to have this opportunity to share this platform with you to express my opinions.
Okay, thank you so much. Nikita, there are many people who are looking forward to prepare for urology entrance. First of all, I would like to know from you, during MS, when did you decide to choose urology?
Sir, I decided to choose urology mainly in the final year. Actually, that time the pattern was different. We were going to be asked only general surgery questions in NEET, so I was mainly reading Sebastian. And just 2 months before the exam, they announced that there would be a separate paper for a speciality. So that time only I decided that okay, maybe in first attempt I would not be able to clear because we have to read a separate speciality branch altogether. So I was mainly planning to take a drop and read urology thoroughly.
Okay, what inclined your interest towards urology?
Actually, in India, female urologists are at a dearth. There are only some 50 odd female urologists, and urology also comprises urogynecology. It means cases like incontinence in females and other urogynecological problems. So in India, females prefer female doctors only. So I thought that okay, this is a good opportunity to serve them, and also I would be a little privileged to be a female in this speciality.
Very good thought. Okay, so you wrote the Aiims exam recently in which
Yes.
you got rank 5. How was the pattern of this exam if somebody wants to prepare? What was the pattern?
Aiims exam asked mainly urology questions, and a part of biostats was also there in theory. 80 marks comprised of theory, and 20 marks were for interview.
Okay. Yes,
So, sir, in theory part, in urology, Aiims, they mainly focused on the physiology and anatomy part and also on the oncology part. Okay. So, renal physiology is unit 7 in Campbell, which any aspirant who is aspiring for Aiims should go thoroughly with, because they ask a lot about little things, and privilege of being a Damsonian in my MBBS days was that even nephrology was covered a lot in the medicine part also. Okay. So even I had these old notes of mine of medicine part, so I also read nephrology from there. So all my concepts regarding GFR and all the physiology of nephron unit and all, so that was very clear from DAMS also.
So you were 3 years student of DAMS Foundation.
Yes.
In Mumbai.
Yes.
During your MBBS days in which medical college?
Grand Medical
College.
Yes.
So those notes and those basics helped you to carry on.
Yeah.
Okay.
And so, all my notes were of DAMS were with me, and biostats part also it gave me an advantage in Aiims exam because there were 7 to 8 questions from biostats, and those I revised a day before exam from DAMS notes itself. So it gave me a good advantage of 8 questions over others.
Very good.
And in Aiims exam from Campbell, those who are thinking that we have to read Campbell through and through, it's not like this. We have to focus on only some units, especially first 10 units. Out of which first 5 units, which comprise of symptomatology and the basic instrument part and male reproductive physiology and infection part. This part comprises almost 50% of questions of any paper, means let it be PGI, let it be Aiims, let it be JIPMER and NEET. So we have to through with first 10 units, and also urinary stones, because urology is all about stones. That is the first thing and most general thing we read. So the unit 11 is urinary lithiasis, which should be thorough from Campbell. If you are not able to read line by line, then just read the bold lines. Bold lines, key points, there are some boxes of key points and diagrams. Only that will do. And there is no need to go through surgical procedures in a length, because we are not supposed to be complete urologists at the exams. They just ask about basics. So even if you leave those big surgeries and the steps of surgeries, only 1 or 2 questions will come with which most of the people will not be able to answer. So it will not decide your rank. Your rank will be decided mainly on those basic questions, which I have told before. And also oncology part is very important, means kidney and male genitourinary, prostate and bladder. So these chapters, oncology part, you have to be through. 2 questions were direct from TNM classification in the Aiims. So even easy questions are there which should not be missed at all, otherwise you will miss a rank. And there are also units on urinary tract storage and emptying. Unit 12 is there, which is almost 22 chapters long. And the last unit in Campbell is pediatric urology, which is about 25 chapters long. You don't need to go in depth of those units, because only one or two questions are asked from those units, and they comprise almost 50 chapters.
Okay.
So we don't have to read much from those units. Mainly focus on first 10 units and the oncology part and the stone part. That's it. And Campbell review is there, which is a MCQ form of Campbell itself. So from Campbell review, you have to solve all MCQs, and at the end of each chapter, a chapter review is given in box. So from those chapter review, Aiims people picked a lot of questions. I think 10 to 12 questions were directly from the chapter review of Campbell review.
Okay.
So yeah, that is very important.
Okay. So you did the test and discussion course with DAMS, SuperSpeciality. How was your experience with that course?
In some exams, like in PGI, both general surgery as well as urology part is asked. So for general surgery, I relied completely on DAMS test and discussion series. Means nothing else was to be read. And also I have those Dr. Rajiv Tiwari sir's notes of my UG days, and those are very precious for me. I did my pre-PG entrance preparation from them, my MS final preparation from them, and now MCS entrance preparation also from them. So I would like to thank sir for giving such precious notes, and that covered almost the whole syllabus. So you don't have to read in detail the MCQ books and all other MCQ books which are available in the market. And in general surgery part in PGI exam, there were 40 questions of single choice, and there was no negative marking in these. And the other 40 questions, means it was a 80-mark paper with equal distribution. So general surgery 40 and urology 40. And in urology there were multiple answer questions, like PGI is famous for what. So in general surgery part, a lot of questions came from that test and discussion course which I did. In the test and discussion course, there were 4 speciality wise videos, and grand test were also there.
Yes.
And the question level was very nice. It was a higher level than asked in exams. So we were prepared for the worst by DAMS. Like we were prepared a level higher than what is asked in exams. Okay. And especially Dr. Rajiv Tiwari sir's 14 to 15 hour lecture is there, and it simplifies GI in such a way that I don't, it was not a need to read it from any other book. Okay. Means for GIT, I just watched sir's video at least thrice or 4 times. So I was done with that portion. And also being surgeon, there is a disadvantage with us that we cannot, sometimes we cannot predict for how much time we are going to work. Like if there is any case in OT and it can stretch for 8 hours, 10 hours, and if an emergency goes heavy, so we are not able to concentrate the next day. So what I used to do when I was feeling low and if tired and I was not in a mood to study, but there was a tension that okay, exams are coming, so I used to watch these solution videos, because these solution videos are they command your attention so much that you forget your tiredness and you get involved, and at the same time you study also. So I utilized my idle time in watching these videos, and I want to thank DAMS for such a beautiful concept of making videos, because these are not just solution videos, just not question answer. They explain that topic in depth completely. So that topic is altogether prepared. And these topics are scrutinized. They are the most important topics from which questions are going to come. So I always, after watching these videos, I feel very confident that okay, at least a chunk of important topics is completed from these videos altogether. So I don't have to read theory. Means a 14-hour video of GI from Rajiv Tiwari sir was equivalent to a 5-day study of GIT by books. So it saved a lot of time.
And it got synchronized with your MBBS teaching
Yes.
also, because you were taught by Dr. Tiwari himself.
Yes.
I think during your MBBS
Yeah,
days.
yeah, definitely.
So very good. And regarding the other videos, urology video you attended in that TND session, urology.
Yeah, urology video was also very nice. It was a summary of Schwartz, Sebastian, Bailey, and some points of Campbell also.
Okay.
And especially, sir covered oncology part very well. Means all the cancers he taught from Campbell itself. He showed key points and TNM classification from Campbell itself. So after watching that video, oncology part was strong, and I not went through detailed description in books. Then it saved a lot of time.
And regarding one more, oncology was all, oncosurgery video was also.
Yeah, oncosurgery video, because in general surgery, oncology part is also asked very frequently, both in PGI and NEET. So oncology part was also covered very thoroughly, especially oral cancer and breast and thyroid. Means they are like a must which are asked. So that part was very well covered in oncosurgery video, and sir also gave us latest AJCC 8th classification change also, which was very important. And actually that was asked about CAPNS in this Aiims exam.
Okay.
It was means in Campbell it was given an older edition, and the new updated version was asked. So in oncosurgery video that was already discussed. So those who read Campbell were at a disadvantage, and I knew the new update. So I marked that answer right. So that was an privilege on my side of being a Damsonian.
Okay, very good, very good. So like many under the postgraduate doing students, like they are currently doing MS, they want to know if they want to prepare for urology entrance, what should they do during MS? I mean, what should they read? How should they proceed?
Yeah, actually, now I think the pattern will remain stable. In our time, it was like just 2 months before the exam, so we come to know that we have to read altogether a complete speciality. So now, those who are aiming for urology can prepare from first year itself. So I think those aspirants should start reading Campbell. But reading everything is not at all necessary. You can start with Campbell review. I mean, I am quite somewhat different from other toppers. Means generally people say that you should read theory in detail and then solve questions. If you want things to be done quickly, so you can go by retrograde approach also. First you see the questions, what the questions are asked, because it's a 4,000 page book. You cannot finish it even with your MS also, because you have to, mainly MS is all about GI and onco basically. We don't have much of urology part except barring 1 or 2 cases. So it's not possible to read Campbell even if you prepare 3 years. So it's better to look from where questions are asked. For that you should read Campbell review first, and then you should see that from where questions are asked, and then you should go to the theory part. And even now DAMS has also launched a detailed urology course also. Yes. So you can refer that course also, that whatever points have been discussed or question have been asked, you can read only that from Campbell. Actually, Sumer sir, when he took one of our lectures in Mumbai during my internship, so he said that all what matters is that आपको question का answer सही बनना चाहिए. And knowledge and all means there is quite a difference between what you want to know and what examiner wants to know from you. And knowledge is mainly tested by result here, right? So just means gaining knowledge is very good, but your gaining knowledge should be in the right direction. So in such a vast course, be if you are specific, if you are revising only those important topics at least 10 times rather than reading a book completely from cover to cover, so it will make your chances better to get a rank.
Any particular book you would recommend to read general surgery from during MS days?
Yes, Sebastian is a must. I think in most of the medical colleges in India, that's the mother book. And also Bailey first part should be covered from line to line, because many direct questions in NEET SS. In my first attempt NEET SS, I got a seat in plastic surgery in Kolkata Medical College. So there also many direct lines were from Bailey first part. So Bailey first part Bailey is a shorter book as compared to Sebastian, so you can just read a chapter from Sebastian in detail and then go through Bailey of that same chapter. So it's like making notes of Sebastian, means Bailey is like a notes of Sebastian, means facts are almost same, but the length of chapter is less. So you can read Sebastian and Bailey together. And in Sebastian also, you don't you can skip if you are preparing for urology, then you can skip the CTVS part. And because that's not much asked, that you can cover in Bailey also CTVS is given, and in NEET only that much CTVS is asked. So, and rest of the Sebastian you have to read and Bailey first part.
Like for example, this was for MS doing students. Now a student who has recently completed MS and want to devote 1 full year for this preparation. So how should he approach if he asks?
I think one should start with Campbell review. Again the same approach, but this it should be with more rigor. I mean, because now as people are getting more and more serious, and now DAMS coaching has been guiding students since their starting of MS. So you will have a lot of competition now, especially those who are preparing since 3 years and you have 1 year to cover. So it should be with more vigor. And Campbell review should be solved at a speed of, I think, 22 pages per day. At a speed of 22 pages per day, it will cover Campbell review in 1 month. And then you can jump to Campbell, and then you can just read important points from there, and keep solving all the DAMS tests and some old papers if you get from online or whatever DAMS provide. So you can just practice questions. And mainly in Uro, actually Uro is the most sought after branch in MCH these days. So facts are limited, but competition is very tough. So you cannot afford even a single mistake. So you have to just revise again and again a lot. So make sure that you read once and then you keep your revision cycles very frequent.
Very good, Nikita. Thank you so much for telling all of this. Sir. Any particular advice from your end you would like to give before we finally wind up this video?
Yes, sir. Sir, I mainly want to, means if I have got an opportunity, I want to share that I was associated with them since long, but I was always dreaming of a central institute like Aiims, PGI or JAPMER. And I couldn't do that well in my MD entrance, MDMS entrance. So there was always a thing in my mind that, okay, I have to crack that exam. Even in my terminal degree should be from a central institute. So from day one of general surgery, it was in my mind that whatever happened in the past has happened, but it does not determine my capability now. Means so I want to ask those people who couldn't do well in any of the exams in the past, it doesn't matter at all. It doesn't decide your capability, because one who has become a doctor is already at the cream of the society. Means you are the most intelligent people in society. So you all are equal. Don't judge yourself that if you cannot make it to a good UG or PG college that you cannot do well in MCH. Because life is throwing opportunities again and again, and every opportunity is a fresh opportunity. Only your approach should be very centralized, and just don't carry burden of your past. You can crack, even if you don't made it to a good college in any of the previous exams, you can make it to a dream college in last. And one thing I also want to clear regarding interviews, that in interviews it is said that there is a lot of nepotism and all, means or generally of those of top colleges are preferred. So there is nothing like that. I was not from a Delhi college per se, but I got good marks in my entrance exam, in interview also. So it altogether depends on how you perform exam to exam. Means nobody is going to leave a good candidate. No institute will also afford to leave a good candidate. So if you are good enough, and if you are from a normal college also, that doesn't matter, and that doesn't decide your result. Another last thing I want to conclude, that please follow DAMS even on YouTube and on Facebook also, because I'm a great fan of DAMS Unplugged. All videos Dr. Sachin sir has also made, and Dr. Sumer sir has made. I watch all of them, and many questions from Aiims and PGI were from those Unplugged series also. Like a video on dual CT scan and 4D CT scan, Dr. Sumer sir explained. So there were direct questions from those videos also. So even in your ideal time when you want to pass time on YouTube, you can watch these DAMS videos, and you never know that you get a question advantage. So you are, I think we all are very privileged to be a student of DAMS, and we should always be associated and should believe in DAMS, because DAMS is an institute which once holds your hands, it leaves you at your final destination, at your dream destination, and helps you at every step.
No, we are not leaving you. We'll continue for
Yes,
further,
sir, that's what I'm saying.
We'll continue further. Wish you all the best, Nikita, for
Thank
your
you so much,
future
sir.
endeavors. Thank you for coming here. I
Thank
hope
you.
all of you enjoy this video. If you have any comments, any queries regarding this, you can ask us and we'll request Dr. Nikita to reply to the queries
Thank you so
also.
much.
Thank you so much. That's all for the
Thank you, sir.